So why did you become an entrepreneur? Why did you want to work in this home health industry? What do you ultimately want? Not just a success in business, but you want success in business because what? Because you want a successful life. You want to be able to provide your family things, right? You want to be providing yourself stuff. Now, you need to know what your why is. Every day I ask myself that. Why am I here? And if I'm talking about my companies that I have, then I'll say, why did I wake up today? Well, I want to be able to call 100 physicians today, or I want to be able to send 100 mailers out today, or I want to call, 100 referral sources today, or I want to call 50 of my clients today. What is your why on a daily basis? Is your why you want to get rich? You want to become successful? You want to take care of your family? You want that new car? What is it? What is that why? So my why that made me learn and create these techniques was that I was forced to market our company. That's right, I was forced to market our company because, like I told you, I never really wanted to get into home health industry, but my parents decided to start a home health company of theirs, and they were generating success and had great people working for them, or they thought they had great people working for them. And eventually one day, our trusted marketer left, and several people in the companies had to go because they were really causing problems in the company. And my mom asks me and tells me, Michael, I need you to start marketing for a company. And I did not know anything about the industry. I would help and visit patients if they needed at times. I would do a couple things for them if they asked me to do things. And that's all I just did. Okay? But eventually I figured, I said, you know what? If I'm going to help out, if I'm going to do this, I'm going to learn everything and I'm going to make sure that I work hard. And so I started going back and other classes that I've taken outside the industry, and I started attending seminars, even though if it wasn't just the home health industry. And I've even attended marketing seminars in our industry, in the home health industry, and I looked at it and I said, this is not going to work. Even I knew it wasn't going to work then. But I still tried. And some items worked, but I had to add more techniques to it, because when you go to other trainings, they'll tell you, well, you need to be able to create rapport with the physician. Look, it's not going to happen that easy. You're not just going to gain that trust. How do you gain that trust? You can't just tell somebody, get them to trust you. Well, what do you need to do to gain that trust? And that's what I'm going to be sharing with you guys, is the what and how, not just do this or do that, buy this or buy that, okay? And so I was able to put together this blueprint, this presentation formula, that as long as I follow this in order, it gave me a higher percentage of success. I'm never going to guarantee you guys out there that every single time you market to someone, you're going to really get them as a client. Not going to happen. What I'm going to teach you is how to find and prospect correctly. And if you actually use the formulas, use the blueprints, it's going to increase the possibility. Now, look, when you start using these techniques, what if these techniques can help you increase your referrals by 2 instead of not getting any? What if you can get 10, 20, 30, 40, 50 referrals because you're using the techniques that you learned rather than just winging it and just doing something and not knowing or not having a process? And I literally tried so many things and failed miserably. But I kept on waking up the next day and said, okay, let's try this, let's try that. And eventually I started seeing success because I was trying. I was trying harder than other agencies that quit right away. Okay? So it's important to have that mindset of things. So tell me, what is the most important thing you want to know from me? I want you to write that down on a piece of paper. And if you don't have a piece of paper next to you, pause this video or run really fast and go grab one really quick. And you should always have a pad of paper. Those 8x11 pad of papers, yellow papers with lines in it for school or for training, that you can buy like 6 a pack at Office Max or Office Depot. Make sure you always have one of those because you never know when you need to do some note takings, and you should always be taking notes. I literally go through these pads of papers, about 30 or 40 of them a year, literally, okay? Because I keep on writing things down, and I keep these pads, and I have a bunch of them in my house, in my office as well. But what I want you to do is I want you to think about what is the most important thing that you want to learn from me, and I can guarantee you most likely you are going to see it in this presentation. But if you don't, or you want me to literally expand more in a certain area, send me a quick video message, and trust me, I will answer back to you. The only way I answer messages from people who I haven't met yet or are not my clients is if they actually send me a video question. That right there is the only way I answer questions who are not my clients, okay? So if you're my client already, then you can send me an email, and I can definitely talk to you that way or by phone. But if you want to be, if this is the first time you and I are going to be talking, you have a quick question, send me a quick video email, or just use your phone and make a quick message and send it to me, and I will definitely respond to you right away. And because my goal is to be able to help you, okay? So what is it? So I want to know so I can help. Literally, trust me, I will help you. I'm not joking. I will help you guys, okay? So now let's start finding out what we're going to be learning here. What we'll be covering. We're going to be targeting the right referrals. Okay, how to target the right referrals. How to literally get people to call you back. Because trust me, if you haven't done it yet, have you ever called somebody before and they never called you back? I'm going to show you guys a technique on how to be able to literally get people to call you back. And this is one of the biggest dilemmas that a lot of marketers face, is that they face and hate rejection. And because they hate rejection so much, when they face rejection, they stop doing what they're doing. Okay, and then they try to do what is easy for you. And my teaching is this: if it's hard, you need to go towards what's hard and not go away from it. Because if you face a problem, if you face what's in front of you, if you face something that is hard, eventually you're going to overcome it and you're going to win it. You need to know how to attack something that you're not used to yet, because that will generate success. You're going to learn 10 reasons why agencies are failing. You're going to learn how to be able to get past those gatekeepers. You're also going to know what to have when marketing, okay? Not just the typical, let me buy a box of donuts from Dunkin' Donuts and drop it off and that's it. There's ways to use donuts in marketing, and I will teach you guys that. Now, I know some people, they'll buy whatever ethnic food that doctor likes and feed them nonstop. Or I've seen marketers drop off a box full of pens and they think that they're just going to get the referral that way. No. There's another company that's going to drop off another box of pens, and then another company is going to drop a box of pens plus some calendars and plus some planners. Okay? These things are a waste of money for you if you're giving away too much. Remember, how much is a pen? 35 cents, 45 cents, even up to $1. And if you're dropping off 20 pens per location, that's a lot of money that is being wasted by a marketer if it's not used properly. And I will show you how to use giveaways properly. And then, look, you need to find out who the worst marketer is. Who is the worst marketer? What makes that marketer a bad marketer? You're going to learn the value of what they call education-based marketing. You're going to learn how to create a correct marketing plan. Your pitch is so important. What's a pitch? We call it the elevator pitch. We call it the USP, or unique selling proposition. Depends on where or how you heard of it. But no matter what, it's a pitch. It's a sales tactic. It's a sales call. It's a call to action. You're going to be able to learn how to create a great pitch. That's very much important to learn. And I will guide you to learning that. You're going to learn the 7 musts of marketing, 7 things that you should always have within your marketing realm. That is necessary, that if you use it and they all link up to each other, you're going to increase the success of your marketing team. And then also creating specialty programs. You need to have specialty programs, people. And what are specialty programs? You have a CHF program. You have a diabetic program. Now, typically some agencies will say we already have that, but just because you have it, do you know it clearly? If I ask you right now, give me a 30-second speech about your diabetic program. Does your nurses in your office know about those programs? And can they describe those programs as well? Those are very important to have. Just because the director of nursing or the owner of the company says we have a diabetic management program, but then nobody knows how to sell it, how to pitch it, how to deliver it, how to present it, then it's not good as well. Look, the most important part is showing you the hows and not just the what. People may have shown you before the what and where. So let me tell you, it's how. It's the how that is more important. You need to know how to deliver things, how to market it, how to present it, how to ask things. Not just what to give them, not just where to go. Marketing to a doctor is different from marketing to a hospital. Marketing to a hospital is different from marketing to a nursing home, and also different when you're marketing in the internet. Okay? Everything is different, and you need to have a specific plan for that. Also, for you non-medical people, all you private duty companies, the price is a myth. And what I'm saying is this, is that there can only be one low-cost home care company in the area. Only one person can be the one charging the least amount. And you, if you want a successful non-medical private duty, you cannot be the lowest priced one. Everybody's always worried about that lowest priced one. Be worried, okay, don't be worried about the lowest priced one. Be worried about the person who's willing to charge less than you but has better products and services than you. Now, people always have that objection, or the price objection, and I will teach you guys that later on in some more techniques. Price is just a myth. Most of the time, is people just want to know that their mom is taken care of, and they're willing to pay the money because they love mom, they love grandma, they love grandpa. It's just most of the time is you don't have the services that they want. And you should not just offer the typical services that everybody else is. How do you make yourself different? How to make yourself stand out? That is what the most important thing. Remember, everybody, the biggest problem for home health industries, for home health agencies, for home health teams is not the fact that they don't have a great marketer. The problem is nobody knows you. So that's why you need the great marketer, to be able to have people know about you. The biggest problem of all home health agencies is obscurity. Nobody knows you. How can you get people to know you is the most important thing. So let me ask this thing. Let us know about you. Tell me about your current census, and if you are just starting, to tell me about your agency. All right? I want you to literally, in the next 20 seconds, okay, give me a 20-second speech about your company. And pause the video if you guys need to. What you want to do is you want to take your phones out really fast, or whatever you can do, or look in front of a mirror and literally sell yourself right now. Tell me about your agency. And I want you to then ask yourself is, after you have done that, would you refer a patient to yourself? Or do you feel that you need help still to be able to make yourself stand out? Would you agree that maybe we can tweak a few more things to make you stand out even better? Do you feel that it is where it should be? Do you feel that your presentation, that quick 20 seconds I asked you to do, was that good enough? Was that good enough to get somebody to trust you? Did you mumble the words? Did you fumble a few words? Did you pause a little bit? Did you hesitate to start talking when I told you to start talking? Because if you couldn't do it right there and then when nobody's in front of you, the likelihood is when a physician says go, that you may hesitate. And just that quick hesitation can cause that physician to not trust you. Let me ask you guys this. When you meet somebody new, within the first 5 to 10 seconds, you already judged that person. You already knew if you liked that person or not. Subconsciously, or knowingly. And it goes the same exact way when you're marketing, is what they see within that first 5 to 10 seconds. If you hesitate, if you show that you're scared, if you show that you're held back a little bit, verbal or nonverbal body language is very important. So why do you think it is only on that level? Why do you think right now, on what you did, on your presentation, on how you did it, why are you in that level right now? Why do you feel that you need to improve things? And the reason for that, the answer for that is this, okay? The answer for that is because you're still learning. I myself am still learning. I always try to see what I can improve myself on. We are only in certain levels because we are always growing. And my goal is to be able to bring you from where you are right now to the next level that you can be to become successful. So, what is the reason home health agencies are failing? So if you're brand new, have you known other agencies that are closing down? And is it surprising that other agencies are closing down, yet more agencies are opening up? And the biggest reason why a lot of agencies are closing down is because nobody knows that they existed. They thought that just opening an agency, just putting a website, okay, just making brochures and sending it to people was good enough. And I really applaud you right now for watching this webinar, because you know yourself that there is more to that. More to just websites, more to just business cards, more through just your brochures. Okay? Now, the real reason that agencies are closing, other than obscurity, is that they are not working together well. They're not working as a team to generate the buzz to get their companies known. If you think that the only way to get the word out about your company is just the marketer, then I'm glad you're here. Because in a marketing plan, in a marketing target, your marketers will open the doors, but the whole team has to seal the deal. The DON has to be part of the follow-up. The administrator has to be part of the follow-up. Your clinicians, your nurses, your home caregivers, your therapists, whether it's an in-house therapist or you're outsourcing your therapy services, all of you guys have to represent the company. And if somebody fails in something, then you may possibly lose that referral. The marketer got the referral source to start referring to you, but your team can mess it up, and then that person stops referring to you guys. And your marketer did a good job, or let's say, for example, your marketing, you're doing a good job, yet then the team is not doing a great job taking care of the, incoming patients or incoming referrals, then ultimately that company is going to fail. Remember, if you do not have a good source of referrals, you're going to fail, because your marketers, your referral sources is the most important part. You may have great clinicians, but if nobody's bringing in patients, then it's not a business. And my goal here is to be able to show you guys what is working out there. So here are the why, and why. And this is the fun part, is when you ask companies right now, why are they also losing, or why are they having problems? Other than the fact that their team is not working together and they don't want to admit that is the main problem, they start pushing the blame outside. They start saying, the reason why we don't have any patients is because the hospitals are keeping their patients. They're not referring it to outside agencies. Or they're saying that, the skilled nursing facilities, the nursing homes, are referred to their own agencies as well. So they don't want to share patients with us. And because of that, that's why we're losing. That's why we're closing down. Another thing is they say, well, my marketer left. We're not doing good because, our marketer left and took away all the patients, took away all the referral sources. And I'm going to teach you guys how to prevent this or avoid this, where your marketer leaves and you actually don't lose your referral sources. And this is where I say that your marketer shouldn't be the only one in charge of these referral sources. Your DON, your administrator, needs to be part of the follow-up process. And the reason for that is because they are also needing to generate a rapport with those referral sources. Because anytime that the marketer leaves, they need to go to that referral source and make sure to talk to them and let them know that they're still here, that they want to service them. And those are very important to have that. Other things that people have said why they're losing or they're not having success is because their nurses keep stealing their patients. Now, some of you guys may not have this problem, or some of you guys haven't faced this or known that this exists, but it happens. Your nurse leaves, and of course the patient wants to go with that nurse, and that nurse is now working for another agency, so that patient transfers with that nurse. So if it hasn't happened to you, it's going to happen to you. And if you think it's never going to happen to you, you need to open up your eyes. Or they're saying that, you know what, the other agency stole my patient. Whether that agency did a health fair at wherever that patient was living, and that patient just liked their information and then started using them and wanted a transfer to that company. Or literally this: I don't pay for patients, but others do, and that's why I'm not getting that referral. Because that doctor is being paid, and I don't want to pay him. I don't want to disobey the law, and that's why I'm not getting patients, because all these doctors are accepting patients. I want to give you guys a newsflash. Are there bad doctors out there? Yes, they do exist. Are there bad home health agencies out there? Yes, they do exist. But not everybody is bad. There's great physicians out there who want great care, as the only pay that they're going to get is that their patients are cared for. That's all that they want, okay? So the problem is, it's not the fact that you lost that doctor because they want to get paid. The problem is you're not increasing the amount of doctors that you're actually reaching out to. If you're only reaching out to 1 to 5 and then they all are, don't want to refer to you, well, then you're going to lose. But if you have 100 people in your pipeline of you trying to actually reach out, then you can increase the percentage of success. Like I said, you're never going to get everybody, but with the tools and trades and techniques and the formulas we're sharing with you guys, it's going to increase the chance of you to have success. And now my favorite whys of why they're closing or they're not being successful is, I don't know, or I don't want a big census. Okay, so people will say, well, I don't know why we're not being successful. I don't know why we're going to have to close our doors down. Well, if you don't know, seek knowledge. Don't wait to the last minute. Just like what you're doing right now. You're seeking knowledge on how to create success. And that's why you're here. And that's amazing. It's so amazing. And then the next one, like I said, I don't want a big census. Look, you want a big census because remember, if you're satisfied with 50, that's all you're going to get. And all you're going to get is a chance for it to go down. So strive for more. I tell people, reach for the stars. If you land in the moon, you still got success. So don't just ask for 30, 40, 50. Go for 100. And if you get 75, or even if you drop down to 50 at times, well, look, it's still okay. Right? So you guys want to be able to reach for more and know that you deserve more and deserve more success out there. So, did I really miss anything? What else is out there? What else has people complain about why their agencies are not being successful? And if there is more, share it with me. I want to be able to hear it. If you know something, I love to be able to learn as well. So teach me something, okay? But I think I pretty much covered everything why people think that their agencies are not being successful.